Morning, everybody. Welcome to another podcast of PassionateSoccerCoach.com. We have a very special guest today, Mia Martinez, in-house. She's going to be talking to us about some injury preventions and how we can extend the playing time of our players. But I don't want to take the thunder away from Mia. I want her to introduce herself and tell us more about herself.
Thank you, Alan. So, my name is Mia. I've been a physical therapist now since 2021, and I mainly work in sports and orthopedics. I have been since I started, but most recently I decided to kind of pursue my dream and kind of my vision of what I think PT should be. So in the last year, I opened up Rebuild Physical Therapy, which is my own business, and here I help athletes return to sport after injury and reach their full potential. And yeah, thank you for having me. I appreciate it.
So talk to us about Rebuild. What do you specialize in? How do you prevent athletes from getting re-injured, or what do athletes have to do to stop getting injured?
Yeah, so I work primarily with athletes. I love treating the high school, college, and older athlete. So I see a lot of soccer athletes actually. And then I also see some strength sport athletes that are competing in powerlifting or Olympic lifting as well. But my pillars, kind of what I run on, are being data driven. And that is I think most important, especially when we're looking at injuries and injury prevention. We need to know where we're at. We need to know where we want to be so we can kind of track along the way. So big for me is collecting as much data as possible. I'm focused on sports as well. So by that, I mean, if we're only having pain while we're playing our sports or participating in those higher level activities, then we have to be training in those higher level activities. And I note that with more traditional physical therapy, we're only doing table exercises and, little things that aren't really, don't have the most crossover to real playing and real practice. So I focus on data, I focus on sports, and then the other piece is accountability and communication. So I always have weekly check-ins with my athletes, with my members, to make sure we're on the right track and that we are doing what we need to do even when we're not in the clinic with me. So I do a little combo of it all just to make sure we get the things rolling in the right spot.
Excellent. Thank you for the introduction. Talk to me about the data part, industry data. Like this is not like particular to any industries, maybe like geared towards soccer. What are some common stats or trends in terms of like injuries? What are some common injuries? Because I believe there's some common injuries that happen. Can you talk to us a little bit about that?
Sure, yeah. I think, well, when it comes to soccer and the most common injuries, unfortunately, I see a lot of ACL injuries. And then the other piece of that is muscle strains as well that are common, particularly hamstring and groin strains for these athletes. And I think most of it is just a buildup of the fatigue over time. It's a sport that involves a lot of endurance, but also involves those more agility moves, having to cut and change direction and move quickly on and off the ball. So I think because of just the way the sport is played, that is what makes those injuries so common. But when we think about it and when we're looking at the data side of it, some of the important things that I like to look at are limb symmetry. So what I mean by that is what one leg is able to do in comparison to the other leg. I think that's huge. The other piece of it is also symmetry-wise, but I'm talking quad to hamstring, and there's a quad to hamstring ratio that we look at as well, just to make sure that our knee is protected, especially with those deceleration and those agility moves as well. Things like jumping and running, as far as velocity goes, I'm not as concerned about with as far as soccer goes, but really looking at the symmetry and our strength.
Strength throughout your legs to support the knees properly.
Correct, yeah.
So early, looks like there's some common denominator. Does gender, any gender specific injuries, or is it common?
Yeah, I mean, we do tend to see a higher prevalence of ACL injuries in the female athlete, especially the female soccer athlete. And I think the data and the science on that is a little bit varied right now. Initially, we thought it was just the anatomical differences in females. We have wider hips. Our angles are a little bit wider than the male athlete. So initially, they were just thinking it was anatomical difference. But I think now research is showing that maybe hormones have a little bit to play. Maybe training age as well. I think it's fair to say that the male athlete is starting their journey on strength training and working out and fitness a little bit earlier than the female athlete. And I think that has they've seen some data where that might play a role too. So it's a little bit multifactorial, but we do definitely see a little bit more of a prevalence of ACL injuries in the female athlete compared to male.
Yeah, that's what I heard as well and read
Yeah.
about it. And a lot of my soccer friends or fellow coaches, they went through the same statistic we just mentioned: ACL, both
Yeah.
knees, and it could be also the turf, could be like grass, change of like it depends what level you play, but the knees take a lot of hitting. And I'm going through strengthening right now myself. I tore my meniscus
Oh no.
and they took it out. So
Yep.
like I was on my legs the same day I was trying to walk it. But I played sport all my life, and now I'm going through a similar place like yours. It's sports integrated into physical therapy. They don't do like where I fall asleep on the bed. No, they make me actually work
Awesome.
and
Yeah.
strengthen. To your point, I think it's gonna help me heal and get back on my full strength quicker, right? Because
That's
I'm
great.
working on certain muscles that I never knew I had, or I forgot that I had from
Right.
college. um, but what can like soccer training or any like athletes training play a factor into somebody's prevention of injuries? I know you mentioned like strengthening and all that stuff. Can you like dive into that?
Yeah, so you're saying like in terms of preventing injury, like what training is good for that, or
Yeah, like throughout different ages, like we deal with a lot of youth soccer. Like when
Mhm.
should like players start thinking about strengthening their muscles? Because I know there's a growth spurt. You go from 10 to 16 or 10 to 20, you're going to be growing, constantly
Mhm.
growing. But when do you start implementing these trainings to reduce uh, the prevention of like getting injured? Like we want to keep our players on the field. We don't want them to be injured on the sidelines.
Yeah, definitely. I think, honestly, I think the earlier we get started with training, the better. And I'm not saying that, a 10-year-old needs to be lifting 200 pounds at all. Nothing like that. But I do think it's important that at an early age, we're learning the movements. We're learning how to squat. We're learning how to hinge. We're learning how to do a split squat as well. We're learning how to do all those movements because a big thing on the as we get older, especially in that like 6 to 12 age range, coordination is huge. And a lot of kids at a young age are kind of lacking that coordination. Um, so that's a huge part of training that might be beneficial on the earlier side of things and building that up into, yeah, we're squatting, but now we're going to add a couple dumbbells to it and seeing how that goes. And I do think that just having a greater training age, and so by that, I'm talking about how long or how many years we've actually been strength training and training, having a bigger training age, having a better understanding of our bodies, but also what strength training and what cardio is. I think all those things can definitely help soccer athletes as they age, as they get older.
Excellent. How does like a warm-up routine help reduce like any injuries?
Yeah, so I'm a big fan of the dynamic workouts and dynamic warm-ups. So moving and doing things a little bit more associated to sport seem to help athletes perform better. There's been quite a bit of research talking about like static stretching. I know that's has been popular in the past. I'm not sure how popular it is for you guys, but static stretching data actually shows that by doing static stretches for too long, it can actually reduce performance. So I'm a big fan of the dynamic stuff. Let's get you working into jogs. Let's get you moving and get those legs going. One of the big things when we think about those injuries, ACL and the knee injuries in particular are tough with soccer athletes. Getting the hip and trunk kind of involved and I'll say activated prior to working out, practice, or game could be beneficial as well.
Mm. What about like so now that they know how to warm up, they're doing the strength training. What about hydration and nutrition? Does that play a role into injury prevention?
Huge. Oh, absolutely. Yeah, we need to feed our bodies. We need the energy to for our body systems to work appropriately, right? So if we don't have the necessary hydration, water, and necessary fuel as far as carbs and proteins and all that goes, it just puts us at higher risk of injury. So yeah, huge.
When you say huge, is there any like data to prove the fact that you need to hydrate properly, that you need energy to burn it? Like there must be some data out there, right?
I'm sure there is. I haven't looked into that side a whole lot on the nutrition side. What I do know, again, I'm a little bit more on the opposite side. I'm the person you go to once you do get hurt, but I do know on the other side of it, as far as nutrition is concerned, they have done some studies, and we actually burn more calories when we're injured than we do when we're healthy, right? So I'll give you an example. I know there's people out there that they get injured, they're sitting on the couch, they're like, well, I shouldn't be eating a whole lot because I'm just sitting on the couch now. So like I'm not going to eat, my regular meals in the day because I need to stay at whatever. But it's actually been found to be the opposite. We need more calories. We should be eating more when we are injured and when we're dealing with recovery than not, because our body needs that energy. Again, we need that fuel to make sure our muscles can repair and our body can recover appropriately.
Yeah, you just touched up on the next point, rest and recovery.
Oh yeah.
That's important as well for us, right? Walk us through it a little
Yeah.
bit.
Yeah. So I think rest and recovery. So I think we just shouldn't be going 7 days a week, 24/7, right? Rest can be something as easy as taking a walk on your off days. It could be active, it could be yoga, it could be, whatever it is, but it is very important that we rest. When we don't rest, it can lead to something called overtraining, which again is going to lead to a decrease in our performance. When we train too much, too long, and don't let our body have the time to repair and build up again, we just increase our risk of injury.
Mm. What about like mental mindset, psychological preparedness? Does that help at all?
I think so, yeah. Again, I'm a little bit on the other side of things, but here's a study. They've been looking at with ACL injuries, for example, return to sport testing and analysis there, and they've come up with an outcome measure called the ACL RSI, which is just based on the mental preparedness piece, and it's literally just questions about that. How do you feel about returning to sport? Are you confident in X, Y, and Z? And they do show that a lower score in that outcome measure actually leads to poorer outcomes out on the field. Those athletes are less likely to return to their full level. They're more likely to then injure themselves again. So the mental preparedness, that kind of toughness and mentality is huge for athletes. And a lot of the times what I will do to help train is like the visualization piece of that. So making sure they can picture themselves out on the field doing the things that they're doing as we're moving through different tasks and different exercises. So huge. Yep.
No, that's important. The right mindset, even in the recovery, when they're there, like you have to be strong enough to push yourself through certain steps where you cannot push yourself, and then
Yeah, definitely. Yeah, I mean,
um,
think like when we get injured, there's like athletes being an athlete is such a huge part of an athlete's identity, right? So like when that piece of the puzzle for them gets taken away, it can be huge, as far as like the burden that it feels and the loss that they might feel. So having that toughness and kind of making sure that, from a rehab side of it, making sure that the athlete feels comfortable, feels okay, and is in the right headspace. But also as the athlete, knowing that this is just part of the journey and we're going to get past it. Yeah, it's very important.
Are there any like lesser known strategies to prevent like injuries, like something out there? I know like you got to warm up, you got to strengthen your muscle. Anything else out there that athletes should be doing to help them prevent?
Let's see.
What would you like say? Like sometimes they say stretching at home could be like like reducing and continue stretching, elevate your feet, get the blood flowing, right? Like hydration. It's something like we talked about it. Rest.
Yeah, I think there's a lot of different like recovery tools, and when I think about it, and I think about the younger athlete, um, I worry most about the overtraining piece, and that's them doing too much, for the full week, for way too many hours in the day. So I would say that, yeah, that rest and recovery is probably the piece that we don't focus enough on. And there's so many different tools and things that we could do. Like I said, we could just go on a walk or do some yoga is good. But I know like massage guns are more widely available these days, and some athletes get some real benefit from that. But I do think that, especially with the younger athletes, not enough um, importance is put on those active recovery days and taking some time off and doing something other than their sport for a little bit. So yeah, I guess the thing that I think is missing is probably not the thing, but just resting.
Yeah, just take a day away
Just
from
take
the
some time.
sport. Yeah, yeah,
Right.
away from and be like be yourself, right?
Right.
That's one of the things I always say. Like I think we overdo it, playing all these different teams, different sports, and then you burn out. You burn out, and then there's a higher correlation of getting injured. And I think you're 100% spot on. What about playing like multiple sports? Like, does that help in the muscle growth? Like, let's say going from soccer to basketball, soccer to lacrosse, baseball, whatever it is. Does that help in the muscle buildup?
Yeah. So that's actually really good for those younger athletes, is to not specialize in sports early. And I know it's very hard, especially these days. Like kids are getting recruited earlier and younger, and we want to be on those travel leagues earlier and younger. But doing a lot of different sports through the year has been good for improving coordination, improving strength, improving that kind of mind-body connection. And it does reduce that feeling of burnout in a lot of kids, and it does reduce injury risk just because we're not doing the same thing over and over again for a full year.
Mm, excellent. Yeah, I'm seeing that. I always encourage play multiple sport. Try it while you're young. Like try
Yeah,
different things. Like be a kid. And just enjoy yourself because I know it's going to help you. If you're an overall athlete, it's going to do well in any sport. Like if you're a competitor
absolutely.
and you work hard. Are there any like technology tools out there to help people like reduce the injuries? Anything you can suggest? Is there anything out there?
Yeah, I think what I've been seeing is, especially lately, is teams are doing a better job at tracking their players' training. So again, kind of goes back to that kind of overtraining and recovery piece of it. But I think we're doing a better job at actually seeing how much time we're spending on the field or working out. And that technology is huge in the prevention of injury, because at least we can see, if we've got a set point of this athlete is cut off when they hit X amount of minutes. If we can at least track that, we can reduce some of that injury risk just by keeping an eye on their training and what that looks like. And I think that's probably the best thing that's happened in the past couple of years is more widely seeing that. I remember growing up that like baseball pitchers would have a pitch count, and that would be their count. And after they hit that, that was done. But we sometimes don't forget, or we sometimes forget about like minutes played is also important. Maybe you should look at that too. So I think that sort of data tracking is has been really helpful for injury prevention.
Excellent. Do you have any like real life experiences, some examples you want to give us? Like some, you don't need to mention names, but like what you're going through, like rebuilding somebody from a particular sports injury, the process and the outcomes, potentially.
Yeah, sure. So I worked with a collegiate soccer athlete. We'll keep it soccer. But I worked with a collegiate soccer athlete who was undergoing a second ACL injury. And tough for her, of course, mentally, having gone through not one, but two, and having to get back onto the field. She was playing at a high level in college and a huge part of the team. So we went through the whole process from day 5 out of surgery all the way till she was back out on the field, and she ended up being nominated for the all team, and she won comeback player of the year for her university as well. So it was really exciting being able to go through all that, and I don't think we could have done that if we weren't tracking where she was at as far as strength, her speed, her agility as time went on, and making sure she was hitting her marks when she was needing to.
What's the typical recovery now for ACL?
It depends. So for the slightly younger athlete, we're trying to hold them back a little bit, I think. So usually by the 3-month mark, they're at least starting to run and jump. By the 9 to 12, they should be getting back into the contact, with 12-month being the return to sport, typical kind of standard timeline of things. For the older athlete, collegiate and professional, that timeline is sped up a little bit, right or wrong, but usually they're running around the 8 to 12 week mark, and then returning to maybe some contact around that 7 or 8 month mark, and returning a little bit earlier than the year.
It also depends on person, right?
Yeah, absolutely. And for me, I the timelines of months and weeks are good to look at just to have an idea of where we are generally. But I would be more focused on where does our strength sit, what is our symmetry at, and that kind of gives me a better guide to when they're ready to move on to the next level than time can.
Okay, tell us where people can find you. I know you have an Instagram out there, social
Yeah.
media. Where can people find you?
Yeah, so I'm on Instagram at pt.rebuild, and that's where you will find me. Currently working, like I said, inside of a gym. So I'm out of Connecticut. Lightning Fitness is where I'm working out of right now. But yeah, just you can, if you're trying to reach me, you can DM me on Instagram or reach me via email at rebuildperformance@outlook.com, not Gmail, Outlook. But yeah, those would probably be the best spots, either DM or email.
We'll post a link for everybody to have
sure.
it out there. But thanks again. Thanks for the valuable inputs. I think this is going to help the audience, the players and parents get some education, even coaches. But it's always good to hear from a professional in the field. Like if it comes from coach, okay, that's great. Coach doesn't know. I'm not an expert, but I've been doing it for a while.
Yeah.
I understand the importance and going through these injuries and importance of how do I prevent it from happening again. So I think it's really, really important. So I appreciate you and your time. And thanks again.